Till noon, and then we will cut into regular programming to bring you that news conference with the governor when it happens. Now, we just got an update on the latest numbers of cases in the Bay Area. There are more than 1,900 cases and nearly 50 people have died. San Francisco is just reporting 374 cases, while San Mateo County is reporting 309 cases, and Santa Clara County has the most with 646 cases. NBC Bay Area's Bob Riddell. He's joining us live from Livermore, where he's sheltering at home. And Bob, do we know what the governor is going to actually talk about?
Well, outside of what you mentioned, there's another issue. We have a vague notion. At noon, this news conference, Governor Gavin Newsom is going to announce a major surge in the California healthcare workforce. I did reach out to his press office to get a better sense of what that means, what that entails. They told me to wait till noon. But here locally, you will have to get used to staying at home a little bit longer, and for those non-essential businesses to stay closed. Sources tell NBC Bay Area News all 9 Bay Area counties plan to extend the shelter-at-home order until May 1st to help slow the spread of the coronavirus. And this jives off what you were saying, Marcus, about what the governor, we expect him to announce as well. In the East Bay, the head of the regional parks is pleading with people to practice better social distancing. The district has already had to shut down some spaces because of overcrowding and people ignoring the 6-foot rule.
We've got to change behavior if we're going to maintain the ability to keep parks open. We're talking to the health department every day, and if we can't change the crowds and the behavior, we could get more restrictions.
A number of new park closures went into effect this past Friday here in the East Bay after the weekend before, when the district saw more people in its parks than on a busy holiday. Now, a lot of us want to know if our efforts to shelter at home and social distance are flattening the curve. Too early to tell. You can see the number of daily cases on this graph we put up for you. You can see that the number of cases daily spiked statewide last week at just over 800. Now we are just under 700. These are as of Saturday night. So the question is that just a short dip before the number of daily cases spike again, or is it the start of a broader downward trend? A Stanford infectious disease epidemiologist told me last week we might be seeing a touch of flattening the curve, but says that we still need more data points, hopefully get a better sense sometime this week as more test results come in. Right now, statewide, there are about 5,600 confirmed cases of COVID-19, 119 deaths. People wondering, could we be the next New York State, where there are almost 60,000 cases and close to 1,000 deaths? We just don't know yet. California has tested far fewer people, and we're still waiting for the results of over 60,000 tests here in the state. Again, the governor will be speaking at noon, just under an hour. We'll carry that live on our NBC Bay Area broadcast, as well as streaming online at NBCBayArea.com. Reporting live here in Livermore, Bob Riddell, NBC Bay Area News.
All right, thank you, Bob. Now, Scott McGrew continues our coverage, and Scott, I know Washington agreeing with Sacramento. We need more time apart just to flatten that curve.
Yes, we do, and good morning to you. Working from home, I'm going to apologize. There's some construction noise nearby. It seems they're building a full crew out there building. I didn't even know that was legal. So let's talk about what's happening in Washington. President Trump, big turnaround. Recently, as this weekend, was hoping to reopen parts of the American economy, remember, as early as Easter. Nearly every scientific mind disagreed with the president, pointing out Easter may bring the peak number of deaths. President Trump relented and extended federal guidelines until the end of April. Even so, models predict if we do everything right, between 100,000 and 200,000 Americans could very well die.
If we can hold that down, as we're saying, to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job.
The decision to not prolong, but to extend this mitigation process until the end of April, I think was a wise and prudent decision.
Now, staying at home will continue to freeze the American economy. We just got word this morning that Macy's plans to furlough most of its employees. Investors really had been expecting this extension, and there may be more extensions in the future. As you took a live look at the big board this morning, mostly baked in, although goodness knows, Marcus, we have seen some wild up and downs in the last couple of weeks. Back to you.
That we have. We will continue to watch the rest of this week too, Scott. Thank you. Well, you know, essential workers who are not first responders are feeling that stress of being on the job when the advice is to keep our distance. This morning, hundreds of thousands of them say that they will be walking off the job unless they get better protections for their health, both physical and financial. Today in the Bay's Chris Sanchez joining us live. And Chris, I know so many people are worried about this. What is this going to mean for consumers if they decide to walk off?
Well, I want to just give you an indication of how popular these grocery delivery services are, Marcus. In the last month, the number of orders placed doubled over 6 months ago. So clearly an essential service for people who feel like they cannot or should not be leaving their home. But if you are expecting a grocery delivery, you may not get it exactly when you're planning to. As many as 200,000 Instacart workers plan to walk off the job today. We haven't seen any of them actually do it at this point, but the employees are demanding more personal protective equipment. They want a $5 per order hazard fee and a default tip of 10%. Instacart says it's distributing PPE, or that personal protective equipment, to full service workers, and that they're launching a new tip setting, but workers are still anxious.
A lot of us are really literally making the decision between, our health and our financial security right now.
Now, if you shop in person, you've seen some of the worker protections now in place, like the plexiglass separating you from the cashier at the register, social distancing reminder, and regular wipe downs. We've also covered protests by nurses who are still calling for more and better PPE from their hospitals, saying that they're being asked to wear the same mask for hours, even as they move between patient to patient. A lot of other businesses are upping their cleaning policies. UPS, FedEx, the Postal Service, they tell us that they're wiping down more frequently and giving more sanitizing. But certainly, if this many people are using those grocery delivery services and those workers decide to walk off the job, it's going to create a bit of a problem for families who are depending on that because they don't want to go outside or cannot go shopping in person themselves. We're going to keep tracking that throughout the day for you as well. In San Jose, Chris Sanchez, NBC Bay Area News.
All right, Chris, thank you. And, just as Scott was mentioning, most of Macy workers are furloughed as the department store chain closed all of its stores this morning. That means a majority of its 130,000 employees will not be working or getting paid. The company says that it will keep only, quote, the absolute minimum workforce. This is what's needed to maintain the basic operations. Online operations won't be hit so hard. Employees who are enrolled in health benefits will continue to receive that coverage. Macy hopes to bring back those workers as the country recovers. And new at 11 for you, UC Berkeley is announcing a new tool in testing for coronavirus. It has developed a pop-up robotic laboratory. Dozens of volunteers will help process up to 1,000 tests per day. Those test results are set to come back within 24 hours. UC Berkeley plans to test its first samples using the lab this week, with the hope that those operations will fully be approved by next week. And the Tokyo Olympics have been officially rescheduled for 2021. The Summer Games will start on July 23rd, and they will go through August 8th, 2021. Now, that is almost exactly 1 year after the Games were due to start this year. Last week, the International Olympic Committee and the Japanese organizers postponed the Olympics until 2021. This is because of the coronavirus pandemic. Remember, you can watch the Tokyo Olympic Games right here on NBC Bay Area. All right, so let's take a look outside for you today. This is downtown San Jose, looking nice and beautiful and clear. Something we haven't seen throughout the entire weekend. Meteorologist Carrie Hall has been tracking that. And Carrie, like this weekend, we saw rain on, rain off, but it's looking nice and clear today.
Yeah, it's nice and clear for most of the Bay Area. There will still be some slight rain chances, but that's for the North Bay. As we get a live look outside, we've been seeing, once again, more sunshine peeking out from behind those clouds. As we check out Woodside, heading to the coast, it's looking pretty nice there. But you can also see the clouds as we head inland to Walnut Creek. So we are going to see, once again, times of clouds and sun, but the rain will be staying away for most of us. As we look at the radar and satellite, we are seeing some rain rain that will be approaching the North Bay going into this afternoon into the evening. Right now it's just to our north. As this new storm system moves in, it will continue to weaken, so we're not expecting all of the Bay Area to see this rain, just mostly areas north of the Golden Gate Bridge. In fact, in Santa Rosa, you only have a slight chance of rain today. You head up to Ukiah and you could see a little bit more, but we can see overall that as we go hour by hour, we will see this weather system as it moves in dissipating, with a lot of that rain not making it into areas south of the North Bay. So I'll be monitoring that as we go throughout today. And temperature wise, it's going to be a little bit warmer due to a little bit more sunshine before that system arrives. I'll talk more about that and also look ahead to some drier weather in the work week forecast that's coming up in a few minutes.
All right. Thanks, Carrie. We know something good to pass along to you this midday. A Walnut Creek restaurant is helping first responders on the front lines of this pandemic. Sunrise Bistro and Catering is providing hundreds of meals for healthcare workers. Now, we caught up with them as they were distributing food to AMR employees. The restaurant says that feedback is extraordinary.
First, they're surprised that we're here and doing this for them. Two, they're amazed that the food's so good, and they tell each other and they get really excited. So one will come out and get a breakfast burrito, and the next thing you know, 20 of them are running out saying, "This is awesome. Where do I get the food? Thank you so much. Thank you for being here."
Now, the restaurant formed a GoFundMe page as a way to raise money to help feed those workers and to keep employees paid during the pandemic. So far, it's raised more than $28,000. Well, something trending for you this morning, and good and pretty funny for you as well. A man dealing with the pandemic by saying hello from the other side.
Hello, it's me. I'm in California dreaming about going out to eat.
He's certainly singing my tune right there. That's singer Chris Mann, who recently appeared on NBC's The Voice. He did a parody of Adele's classic song, Hello, describing what it's like to be stuck in his home during the pandemic. Now, I just checked on YouTube of this video. There are close to 3 million views of that already. So if you want to check it out, go do that. Well, coming up for you this midday, New York is considered the epicenter of the coronavirus here in America. Today, medical tents are being set up in Central Park, what healthcare workers are asking for now. And more health insurers saying that they will waive co-pays for the coronavirus treatments, the two big ones that are jumping on board. And tomorrow night at 10, watch a NBC News special report on the coronavirus pandemic. NBC is collaborating with Facebook and Instagram to bring you the most complete coverage. We'll be right back. Welcome back. The CDC has put new travel advisory in place for New York, New Jersey, and Connecticut. The tri-state area is considered the epicenter of the coronavirus outbreak here in the U.S. And as the death toll rises, hard-hit New York City is scrambling to provide more hospital beds. NBC's Gabe Gutierrez is in Central Park, where they are building a mobile hospital.
As an emergency field hospital is being built in iconic Central Park, New York, New Jersey, and Connecticut are now under a 14-day travel advisory. The CDC is urging people in the nation's worst coronavirus hotspot to halt non-essential domestic travel as cases top 70,000 in the 3 states, with over 1,000 deaths.
Not a lockdown, something much more consistent with what we've been actually saying and doing in the city and state already, which is telling people to stay home unless they have an essential reason to go somewhere.
Today, the USNS Comfort is due to dock in New York Harbor. It will serve as a floating 1,000-bed hospital for non-coronavirus patients, freeing up beds on land.
We still have to take care of pregnant women who have to deliver. We have to take care of patients who need emergency surgery. We have to take care of kids.
In the Bronx, ERs are packed.
We are seeing a lot of younger patients that are coming through the door that are sicker as well, and that is surprising and a little scary.
Concerns are also growing about the lack of personal protective equipment, or PPE, for healthcare workers.
It's incredibly frustrating for us. Our coworkers are getting sick.
The last 5 days have been the busiest ever recorded by EMS here in New York City. As for this field hospital in Central Park, it is set to open tomorrow. Gabe Gutierrez, NBC News, New York.
Now, the White House coronavirus response coordinator says that she's very worried that 100 to 200,000 Americans could die from COVID-19. Dr. Deborah Birx appeared on the Today Show this morning, warning that all Americans need to take this very seriously.
If we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities. We don't even want to see that.
Now, Dr. Birx urges everyone to respond in a unified way by practicing social distancing and listening to shelter-at-home orders. More health insurance companies say that they will waive cost sharing on coronavirus treatments. Cigna and Humana say that they will waive cost sharing for all COVID-19 treatments, including hospitalization and ambulance transfers. That extends to individuals insured through the companies and to employer group plans. That waiver also applies to any FDA-approved medications and vaccines when they become available. Last week, CVS Health's Aetna division became the first major insurer to waive the cost on coronavirus-related hospitalization for in-network. And happening now, visiting California state parks by car just got even harder. The state has now shut down vehicle access to all 280 sites across the state. Previously, all parking lots were off limits, along with some state parks and beaches. Well, the latest response comes after another surge in visits over the weekend. And a way to say thank you to essential workers during the pandemic. According to the Press Democrat, an event planner and her 2 friends recently visited a Roanoke Park shop that was forced to shut its doors. This is due to the shelter-at-home order. So listen to what they did. They found a cooler full of flowers, and they actually were headed to a dumpster. So instead, the trio took those supplies, made bouquets for 50 hospital workers in Santa Rosa. They actually put those flowers on the employees' windshields as a surprise. That's really nice. I love seeing stuff like that.
That is nice.
You know, and with those flowers out there on a
Yeah.
nice daycare, it's just a great way to start the Monday.
It is. We've seen so many people doing great things around the Bay Area and around the world to help each other out. Now, I don't know if it helps at all, but let's take a look at some of our live cameras around the Bay Area as we are starting to see a little bit more sunshine. If you can't see it out the window right now, let's take a look at our live view from the San Jose foothills. Now that we are getting some more sunshine after a cloudy weekend with some off and on rain, now every now and then we did see the sun kind of peeking out from behind behind the clouds, but right now it's looking a little bit clearer here, but we are seeing a lot of clouds in parts of the North Bay, even some rain on some of our upper elevations. And then as we head over toward Belvedere, looking towards San Francisco, we are seeing a mostly cloudy sky right now. So it's been kind of a mixed bag as we start to see one weather system moving out and another weather system moving in. Looking live in Walnut Creek, we are going to continue to see mostly cloudy skies as we go into the rest of today. And then as we check out our forecast, our temperatures will be a little bit warmer too. We're going to see some high temperatures reaching into the low to mid 60s, some upper 50s in the North Bay, where I do still think we'll see some of that rain moving in. In Martinez, looking at highs reaching up to about 63 degrees at 3 to 4 o'clock today. And our high temperatures in Napa reaching 59, 65 in San Jose and in Morgan Hill. That's where we will see some more sunshine. But looking elsewhere across the country, we're not the only ones being told to shelter at home, of course, but look at these temperatures. It's really hard when people have had a really harsh, long winter, and then you start to see the temperatures warming up. In Chicago today, they're going to reach up to 58 degrees. New Orleans at 80 degrees today. And then look at Miami's high temperature, 94 degrees. Maybe there you just want to stay in the air conditioning. In Phoenix today, reaching into the low 70s. So we compared that to what we're seeing here as a new cold front moves in. And this one will be very weak. It continues to fall apart in terms of rain as it moves closer to the Bay Area. So that's the reason why I'm only expecting some showers in the North Bay, because as it moves in, we haven't seen a lot of rain with this, and by the time it moves south of the Golden Gate Bridge, that rain will continue to fall apart. Going into the next several days, we have a dry week and warmer weather, but this weekend returns with more rain and also a slight cool down temperature wise. We're looking at in the near term up to about a quarter inch of rain in Ukiah, and I think the rain chances will start to ramp up between 4 and 6 o'clock this evening. We don't have a lot of snow in the forecast for the week, but this weekend in the Sierra, we're looking at least 12 inches of snow in some of our resorts, up to 17 inches of snow in Kingvale. So the next weather system coming in this weekend looks a little bit better in terms of Sierra snow, but it's going to come after several days of some warm weather, highs reaching into the low 70s for the inland areas by Thursday and Friday. And for San Francisco, expect highs in the low to mid 60s, a little bit cooler during the weekend when we see the waves of showers off and on, but this may hopefully help keep people inside. We've been saying over and over again, now is not the time to spend all day out at the park playing basketball or volleyball. And because we didn't really cooperate with that, now they're having to close those parks and the parking lot. So hopefully we'll get it a little bit better in control this weekend as some more rain moves in. Marcus, that's a look at our forecast. It looks pretty sunny over the next few days.
All right, I like the sound of that. Thank you, Karen. Well, a vital tool to help a school disinfect its campuses is stuck in transit. Chris Kimura and our NBC Bay Area response team is next with the way they help make the delivery. But first, happening now, Florida's governor says that it was surreal as he and his wife welcomed a new baby into the world shaped by the coronavirus pandemic. Governor Ron DeSantis says that he chose not to be in the delivery room as his wife Casey gave birth to their third child, a daughter named Mamie. That's because the couple decided the personal protective equipment the governor would have worn was more urgently needed by medical personnel. DeSantis called it kind of sad, but the right choice. Back with you with more news after the break. Welcome back. NBC Bay Area responds to a South Bay man's virus-related shipping issue. He asked consumer investigator Chris Camore and his team to deliver.
Good morning. Ed works for a South Bay school district. He was waiting for UPS to deliver 2 industrial sanitizers. These right here. They're worth about $7,500 a piece. Ed says he tracked the shipment from Georgia to San Jose. So it made it from here to here, but the problem is the shipment never got onto a delivery truck. The sanitizers just stalled for 3 days. When Ed couldn't get a straight answer from UPS, he contacted us. We contacted the company's headquarters in Atlanta. A rep responded right away. UPS then delivered the sanitizers to the school district. We asked what caused the holdup. UPS didn't respond, though. Its website says it is open for business, but does indicate a caveat that might apply if you're shipping something right now. It says UPS is maintaining delivery services except where limited by government restrictions. So until the pandemic ends, take a second to verify that your next shipment is actually allowed to go wherever it is you're planning to send it. We're taking virus-related questions every day. Go to NBCBayArea.com, then click Response from the main menu. Or call us 888-996-TIPS.
Well, something good this morning in the Bay Area as residents do what they can to help healthcare workers on the front lines. A Berkeley couple using Facebook to connect first responders to who need those face masks to those who actually make them. Berkeley side spoke with Linda Franklin and Fred Dodsworth, and they actually got involved because both of their daughter-in-laws are doctors. Pretty cool. Well, coming up for you, Governor Gavin Newsom is expected to speak in about a half an hour. What he's expected to announce about California's stay-at-home order. And Instacart and Amazon workers warning about a strike, the demands these essential workers want. And welcome back to our midday newscast. We're actually on an extended period. This is to get you the most updated information dealing with coronavirus. I'm Marcus Washington. Now, Governor Newsom is speaking at noon today, laying out his plan for reinforcements for healthcare workers. He could also follow President Trump's lead and extend California's shelter-at-home order through April. And San Francisco Mayor London Breed and other San Francisco officials are expected to give an update any minute now. We want to give you a live look there. You can see this is where they will be speaking a little bit later this morning. And of course, we will bring you that conference live when it happens. Now, some workers for two delivery service giants, Instacart and Amazon, are preparing to walk out on the job. They're actually demanding added protections from the coronavirus. This includes better pay because of the massive increase in business Many people are using these services, especially now, because they don't want to get into the crowded places and go there. And it's not just supermarkets. Instacart partners with pharmacies, Live, CVS, and wholesalers like Costco as well. NBC's Sam Brock reports thousands of workers could walk out of the job.
This morning, a food and supply lifeline is about to be shut off. Instacart employs 200,000 independent contractors, and some are threatening to sit on the delivery sidelines unless they get additional hazard pay of at least $5 per trip and basic protective gear like hand sanitizer and masks.
A lot of us are really literally making the decision between, our health and our financial security right now.
One man who just quit his Instacart job, writing on Twitter, #Instacart strike on Monday. Instacart's attempting to strike break by offering bonuses of $25. No. Just last week, the company announcing plans to beef up its workforce with 300,000 more people. Instacart declined to comment on specifics, but in a statement said they're immensely grateful for the work of their employees, offering bonuses ranging from $25 to $200, more than a month of sick leave, and soon hand sanitizer manufactured just for their shoppers.
Honestly, daily, I sort of go through this argument in my head of, am I a potential vector or am I actually helping?
Shane Schlager delivers for DoorDash, a competitor service. He says he gets hand sanitizer for work, but not much else.
Do you think you should be getting other PPE, masks and gloves? Should that be a given in this field?
I think it should be. I've been personally using my own gloves. I couldn't find any masks, or I probably would use those.
DoorDash says they're providing financial assistance to eligible Dashers diagnosed with COVID-19 or quarantined, and changing the default delivery method to a no-contact option, minimizing face time between Dashers and customers. Schlager still delivering for now, but hundreds of miles away in Staten Island, 100 workers at an Amazon warehouse are walking off the job today.
We're very low on masks. We don't have the proper gloves. All we want is the building to be closed and professionally sanitized. I'm afraid to go to work.
Amazon responding by saying these accusations are simply unfounded. We've taken extreme measures to keep people safe, tripling down on deep cleaning, procuring safety supplies that are available, and changing processes to ensure those in our buildings are keeping safe distances. This trend of striking for safety coming at a critical time for homebound Americans. A new study finding 40 million households have used online grocery delivery in just the last month, doubling the figure from just 6 months earlier. A surge in need as those on the delivery front lines are looking for a little peace of mind in these uncertain times.
Sam Brock reporting there. A lot of companies, including Instacart and Amazon, offer paid sick leave, but it's only if the employee tests positive for COVID-19 or if they're quarantined. Of course, if anyone even suspects that they're sick and might have coronavirus, the last thing public health officials want is to have them out in the public, let alone working with deliveries. And back here in the Bay Area, San Francisco is rapidly expanding its public drive-through testing program, with the latest expansion focusing on healthcare workers on the front lines. San Francisco now has 340 confirmed coronavirus cases. Those numbers are expected to surge this week. The mayor's office says 3 new drive-through sites will open in a matter of days, bringing in the total number of public sites to 7. First responders and healthcare workers will receive priority, as well as those with doctor's referral. San Francisco Unified is cutting back on food pickup days for the students to reduce traveling outdoors. Families will be able to pick up those meals from certain locations only on Mondays and Wednesdays. The district will still give out 5 days worth of meals. This is for the week. District leaders say that students don't have to present or even show proof of enrollment to pick up the food. To see the updated schedule for San Francisco Unified, visit our website, NBCBayArea.com. Many restaurant owners are worried that they won't be able to reopen or even stay open at the end of the shelter-at-home order. In a letter to the governor, the California Restaurant Association says nearly 30% of businesses could go under permanently without help from the state. The association is asking the governor to delay planned minimum wage increases. Here in the Bay Area, Mountain View City Council takes the steps to help during the crisis. The city approving an $800,000 relief package to help bail out small businesses like restaurants, as well as provide shelter for the homeless. Well, San Francisco is creating more social distancing at homeless shelters by using the Moscone Center. The facility at Moscone West is expected to open this week and provide people with a place to stay for the duration of the crisis. Some people already staying in city shelters and navigation centers will move there. In the South Bay, leaders are looking at expanding care to the homeless in San Jose. The Santa Clara County Fairgrounds will soon house up to 80 homeless people, providing them with cots and at least 6 feet of space. Now, the trailers from the state will also be used to isolate those who test positive or show symptoms. Local leaders say that the homeless are more at risk than the average person. And amid the shutdown, BART ridership continues to plummet. The agency says over the weekend, on Saturday, there were only 12,000 riders. That's 8% of the ridership on a typical Saturday. With so few riders, BART is sending crews to the Milpitas station to do some work on the elevators and escalators. Meanwhile, around the globe, there are 741,000 cases, according to Johns Hopkins University. More than 35,000 people have died. Europe remains the epicenter of the pandemic as that death toll rises. NBC's Keir Simmons reports from London.
In Italy, priests bless coffins in rows. The death toll now nearly 11,000. The terrible new challenge, how to deal with so many dead. In Spain, the hospitals now inundated with patients. The Spanish death toll more than 6,800. A court of justice turned into a morgue to house the many taken by this most unjust of killers. France's frightening numbers, now more than 40,000 infected. So many, they're sending patients to Germany. So far, France has seen more than 2,600 die. But the numbers in Europe could be overshadowed by countries like India, where recorded infections are only beginning their ascent. India locking down, leading to crowds trying to get home. The reality of social distancing in a country of 1.3 billion. The UK, like the US, facing a long fight.
I want to update you on the latest steps the government is taking.
The Prime Minister, himself infected with coronavirus, rallying his country on a cell phone from self-isolation.
We are going to do it. We are going to do it together.
One British government health official says life will return to some kind of normality, but that could take 3 to 6 months. Another lesson from over here in Italy again, where the lockdown has lasted for weeks. They're seeing that some people are struggling to maintain the principle of staying in their homes. 50 people arrested who are actually testing positive for coronavirus still out and about. Those people may face jail. Keir Simmons, NBC News, London.
Los Angeles Mayor Eric Garcetti is warning of many more cases there in the coming days and suggesting only people with serious symptoms should seek out a hospital. Researchers at Cal State Northridge have introduced a new coronavirus mapping tool. It tracks LA County cases by neighborhood, which now numbers more than 2,000. Unlike the Bay Area, health agencies, LA County does allow the release of the patient's specific location. LA County has a record 37 coronavirus deaths. Garcetti is encouraging everyone to continue their home isolation as teams crunch the data on how to successfully finish all of this.
We know that slowing the spread will take some time to see, and it will still be a week or two before we see the impact.
To prepare for the possible onslaught of patients, the city plans to use the LA Convention Center as a federal field hospital. Teams are also in the process of opening up 5 new shelters to help keep the homeless off the streets. And patients are officially on board a Navy hospital ship docked in Los Angeles. The Navy ship Macy opened its doors on Sunday. It is housing patients who do not have coronavirus. That goal is to keep free the space in local hospitals for patients with the virus. The ship docked on Friday and has 1,000 beds, more than 800 Navy medical personnel and support staff on board. And with more than 200,000 Americans being asked to stay home, many are finding new ways to stay connected, while others are turning to tried and true ways of reaching out and touching someone, like long phone calls and even writing a letter. Well, here's NBC's Joe Fryer.
If folks were to start drawing...
These days, connection and community come in unexpected forms, from virtual happy hours.
Mine's a quarantini because it's water.
to brunches and dinner parties now happening remotely.
Thank God for all of our devices and our FaceTimes and our Duos and our Zooms and everything we're using, because it does not feel so awful. You still feel connected.
NASA astronaut Nick Hague says some of the tools he used in space can help those of us trapped in our personal capsules here on Earth.
When I was on orbit, I'd do crossword puzzles with my boys over a video chat, and just being able to connect that way was such a huge emotional boost.
Zoom meetings have exploded in popularity over the past few weeks. It's now the #1 free app for iPhone and Android. But not everyone has access to the internet or feels comfortable using it.
Hi, Grandma.
Hello, the phone call is back. Verizon says its phone traffic has gone way up. Each weekday, nearly 800 million calls are being made, twice the volume of Mother's Day. And people are staying on longer, too, 33%.
Right now, one of the most kind things we could do is pick up the phone, take a picture of your smiling face, send it to that person who we know is alone or scared right now.
For some special occasions, there are drive-by birthday wishes. For others, sign language.
Grandma, look at the sign.
It's a boy. I just had a feeling.
And for something that lasts even longer, old-fashioned letters are making a bit of a comeback, says Arkansas high school student Michelle Wells.
Not a lot of people my age really do it, but I really enjoy it.
If there's no time for that, a short text can say so much. Experts say even the little pings matter. Just checking in regularly with someone can make a big difference. Joe Fryer, NBC News, Los Angeles.
I love that announcement with the grandmother there. You know, with all the heartbreak across the country and the nation right now, here's something that will shape a smile on your face. Communities across the country are working to spread cheer to others. A Facebook page called Heart Hunters is inspiring homeowners to hang up hearts and other messages of hope on the windows of their homes. So that idea quickly taking off, with many people sharing those photos of their designs in the Facebook group. It's really nice. A smile makes a lot of things better sometimes. All right, well, you know, our friends at California Live, they are next with the right way to sanitize your groceries and stuff you brought from the grocery store or any store you're heading out. We're going to talk about that when we come back. We'll be right back.
Hey everyone, and welcome to this special stay-at-home edition of California Live. Hey ladies, how are you? How was your weekend?
Hi ladies, our weekend was great. You know, we had a few dance parties, we got a lot of cleaning done. I organized the kitchen, which is something that I have been wanting to do for months now. So kind of taking the opportunity and the chance to do all these things around the house.
Yeah, I tried to lay a little low, dive into the taxes. Don't even, I don't even want to think about that anymore.
No.
But
That's
going
more
to
stress,
the grocery
Danny, more
store,
stress.
going to the grocery store, and I have to admit, every time I buy something and I bring it into the house, I'm a little concerned that I'm just bringing germs into my place. So I don't know what to do.
Yeah. I know exactly how you feel. How do you know if you're getting food delivery or if you're shopping or getting other packages delivered? How do you know if that is safe? Well, Nurse Barb, of course, comes to the rescue and she has some answers for us. Today we want to talk about how you stay sanitized when you're going for food delivery, going to the market, or even having things delivered to you. So Nurse Barb is here to help us out. So we have to stay sanitized. What should we do?
That's right. And we also want to support the economy, right? So you're doing your part by staying indoors and you're having things delivered, whether it's an Amazon box, but you've probably heard the current research shows that the coronavirus can live on cardboard for 24 hours. So what are you supposed to do?
Right. So what should we do?
All right. So Malu, you and I talked about having food delivered. What I'd like you to do is get those household gloves that we talked about. Don't leave the cardboard outside for 24 hours. Bring it in your house, but wear gloves and put it on a towel on a surface, right? Because then you can wash that towel later. Unpack everything wearing your gloves. And if you're ordering food, order food that's hot or that can be reheated. Then take all of the packaging, roll it up, put it in the garbage, and then take that towel and put it in the laundry.
And then also disinfect the surface, right?
Oh gosh, thank you so much. Disinfect the surface with, you can use a diluted bleach solution, and you can find that on the CDC website.
You taught me very well, Nurse Barb. So just make sure you wear the gloves, make sure that you disinfect, and then make sure you wash things too. Wash your hands all over again. That's the best way to do it. And heat your food.
That's right. As much as I'd like to say you can order salads or cold food, it's best for you to heat the food because the virus dies with heat. And that's why after you're out and about, you're going to wash your hands with soap and water. And if you're taking a shower, hot water and soap will help kill the virus.
All right, great tips. Nurse Barb, as always, thank you very much. Stay safe and stay healthy out there.
Thanks, Malu. Take care. Bye-bye.
Yeah, that's so interesting because it's gotten to the point where my husband and I will open up our packages or any delivery that we have outside of our house. We'll sanitize everything. We'll open it up, sanitize the contents inside the box, and then bring the stuff inside the house. You know, we've gotten a little crazy, but you have to.
Look, Jess, you can never be too careful. So
That's
you are
true.
not crazy. And I cannot believe that germs live on a cardboard box for 24 hours. That blows my mind. Seriously.
Yeah. And then just remember to always reheat your food. That was one of the best things she ever told me. It was like, make sure that you have cooked food because heat kills the coronavirus. So all good tips. All right. So for now, thank you so much for hanging out with us. Remember, you can always go to our website at nbccalive.com or follow us on Instagram at nbccalive.
Bye.
Some good information there. Well, Carrie's up next with that microclimate forecast for us. We'll be right back. Right now, let's get a look at what we can expect with that forecast for you today. Meteorologist Carrie Hall's been tracking that. So, Carrie, how are we looking?
It looks pretty good. It's starting to clear up across much of the Bay Area, so a little bit more sunshine today. I think that will help lift the spirits as we get a live look outside in San Jose. Actually looking at Sonoma, because we did see some rain in some areas, especially in the hills, and now it's bright green. Also seeing more poppies there, but of course, we're not heading out there. We're just taking a look on the camera right now. Here's a look at Ocean Beach. I have seen quite a few people here. Hopefully they're maintaining their 6 feet of distance out there as you walk around the neighborhood, but do not drive to these areas. There's nowhere to park, and they're not recommending that at this time. Now let's take a look outside in San Jose, because we are seeing more sunshine here, and our temperatures that will be warming up into the low 60s for the rest of the afternoon. So we'll be a little bit warmer today. The rain has moved out, and we'll see highs in downtown San Jose reaching 65 degrees, also 65 in Morgan Hill, and up to 62 today in Livermore. Oakland reaching 61, and San Francisco reaching 60 degrees. Now we will see some upper 50s in the North Bay because of some light rain moving in. So we've seen the off and on low clouds, the rain that has been in that area, moving into far northern California with a new storm system that's approaching. And so as we go hour by hour, we're going to see our rain chances going up from Santa Rosa on northward. And we may see a couple of those spotty showers making it into Marin County during the late night hours, but for most of today, we will stay mostly dry. Going into tomorrow, we're going to see a lot of sunshine, and once this weather system moves out, the rest of the week is looking nice and sunny, and temperatures are going to warm up too. So if you're at home and you're cleaning, open up the windows, let some of that fresh air in. And by the weekend, we're going to see our temperatures cooling off as a new storm system arrives. In the near term, we're looking at highs up to the mid 60s, I should say, but looking at a rainfall estimate, about a 1/4 inch of rain in the forecast for Ukiah. And over the next several days, there won't be a lot of snow for the Sierra, but we are expecting a pretty significant storm system to come in by this weekend. Now, once it gets here, we're looking at least a foot of snow, maybe even a little bit higher for our resorts. We know at this point, every little bit helps, because we're trying to build on that Sierra snowpack for our summertime water storage. And our 7-day forecast shows that by the end of the week, we'll reach into the low to mid 70s inland. For San Francisco, expect a high of about 60 degrees for today, mid 60s by the end of the week, and it's just going to cool down a few degrees for the weekend, but maybe those showers coming back will help motivate us to stay inside, maybe watch a movie or catch up on a book, but we are going to have some nice weather throughout much of this week. And we're going to continue to watch that. We'll have more news coming up for you after the break.
take a look at this. A now viral message from UCSF and Kaiser San Francisco doctors and nurses. You can see there that sign reads, quote, "We stay here for you. Please stay home for us." And a Seattle nurse gets the recognition she deserved after finishing yet another long shift. Well deserved. Well deserved. We're seeing so much of that around. People just acknowledging those people who are just giving their all to help with this virus. Is really just hitting us all so hard, Carrie.
Yeah, hopefully those cheers continue even after all of this is done and over with, because we don't really realize how hard they work. So let's continue that goodness around the world and the Bay Area. And we're going to see some more nice weather in the forecast, Marcus.
All right. Thanks, Carrie. Well, that does it for our midday newscast. Remember, you can tune back in at 5 o'clock tonight. We'll have the latest information. See you then. And we interrupt the regularly scheduled programming to bring you a live press conference from the mayor of San Francisco, Mayor London Breed. Speaking right now, she is actually updating us on what the city is doing to battle coronavirus.
To make sure that in places where we have single room occupancy hotels, where our shelter systems are, and places like Laguna Honda, which house a significant population of elderly patients, we had a plan and we were going to keep people safe. From the very beginning, we knew this would be a challenge. And many of you have heard about some of the recent information of staff members being tested and coming back positive in Laguna Honda. And since then, we've been taking a number of steps in order to test others who might have been in contact with those individuals. And thus far, what we have learned is 9 employees of Laguna Honda Hospital have tested positive, as well as 2 patients. And we are still testing people at Laguna Honda Hospital, and we'll have more information about the specifics once those test results come in, and Dr. Colfax will provide some more details as well. We knew the situation would be challenging, and so immediately last week, I sent a letter to the Federal Department of Human Services asking for significant support so that we could not only focus on making sure we provide the resources and support to this hospital and we don't continue to drain other services, but we have the expertise and the testing on site and the other things that are needed in order to prevent something from happening that we know has happened in other places throughout the country, including in Washington, that house a significant population of elderly patients. Laguna Honda is one of the largest hospitals of its kind anywhere in the country, housing over 750 very, very vulnerable residents who cannot take care of themselves. And this is basically their home, and this is where they eat, this is where they live, this is where they're cared for. And so we have been taking immediate steps in order to help support this hospital and support the people and the staff who are a part of it. We were fortunate in that the CDC on Friday, after sending that urgent request to the U.S. Department of Health and Human Services, the CDC has sent us 2 infectious disease doctors and 2 epidemiologists. And the California Department of Public Health has sent 2 infectious prevention nurses to help assess the situation at Laguna Honda and to make recommendations. And we also have a dedicated staff member at the CDC in Atlanta to help monitor and facilitate the situation, specifically at Laguna Honda, because we know that, again, this is a very vulnerable population. More testing needs to be done. And it's going to be important that we have the resources and we have the support necessary to protect and save lives. This is just a start, and I am grateful for what we've received, but I want to be clear, it's not nearly enough to get us to a...
All right, now we're listening to Mayor London Breed express what the city is doing as they continue to try to battle COVID-19. Right now, we want to go to another press conference that's happening right now. Governor Gavin Newsom is holding a press conference. Let's listen in to what he is saying.
Flexibility on staffing ratios, on scope of practice for nurse practitioners, EMTs, and others. We are going out now to deeply find the kind of talent, though, that is necessary beyond the scope of practice changes and beyond the regulatory changes, and to make sure that we have the adequate workforce. Looking for mental health experts, looking for more EMTs, more pharmacists, looking for more phlebotomists, looking for more experts in respiratory care and the like, technicians, administrators, doctors, nurses. We are calling on you to step up and step in and meet this moment. We have more licensed healthcare professionals in the state of California than any state in the nation, some 766,000 professionals in the state of California. But we estimate we have the capacity to increase our ranks by an additional 37,000 plus professionals that are in that time of life where they, again, may have just recently retired or they're in the process of getting their license and their degrees. And so we are very, very hopeful with this effort that we will see a surge of individuals to be paid and compensated to participate in the workforce and distributed throughout our care delivery system all around the state of California. I will have an individual and representative here in a moment to talk more specifically about what that means, and also to remind everybody it's National Doctors Day in the United States of America. And again, just deep respect and admiration for all of our frontline employees for meeting this moment. I also want to express deep respect and admiration to Mark Zuckerberg and Facebook, well aware of the need to surge with our healthcare capacity. They are providing stipends for individuals that need transportation funding, that need childcare support, if they're going to participate in this workforce, that can get the kind of support on things that otherwise we wouldn't be paid for. Things not just like childcare and transportation, things like hospital, or rather hotel rooms and accommodations. So they put up $25 million, and we're very grateful to Facebook for providing those stipends to help us in areas where we need a little bit extra support. Again, that's the spirit of California. That's the spirit of this moment. It's the spirit that's driving our resolve. Driving that resolve as well is the aggregation of all of these physical assets that have taken place and shape over the course of the last few weeks. From the USNS Mercy that now took their first patients just yesterday in Los Angeles, to the 2,000 rooms that will be surging from the support of the federal government, these field medical stations. We already have our Santa Clara operation up and running. We have Riverside up and running. We have work being done in Los Angeles and San Mateo that will share some of that surge in San Francisco, part of the FMS process, again, already operationalized. Seton Hospital already operationalized, that we brought into the portfolio of assets here in the state. We've been talking over the weekend to get St. Vincent, 366 beds in Los Angeles, fully staffed up as well. And we'll have some specific announcements on that in the next few days. Community Hospital down in Long Beach, we're starting to see that all take shape in real time. We have other hospitals we've identified in addition to the FMS sites in the USNS Mercy. We are also looking to get some 1,000 skilled nursing facility units up and running, and we have indeed made real progress in other areas from Fairview and Porterville, and now working with the Army Corps of Engineers that has now looked at 15 high-priority sites. They've got 4 more that they'll be looking at, from the Sleep Train Center here in Sacramento to Oakland Coliseum to the LA Coliseum and other sites throughout the state of California, looking at those sites as potential surge sites, all part of the plan to increase by 50,000 beds our available capacity within our healthcare delivery system. We have distributed now some 32.6 million N95 masks in the state of California. We have our sights on getting that 101 million that we have locked up into the state. And every couple days, more of that PPE comes in, not just N95 masks, but coveralls and shields and gowns and gloves, glove sets and the like. And so as soon as we get them in, we get them out. Yesterday, we were getting in a number of ventilators into Bloom Energy for refurbishing and reconfiguration. I'm very pleased the 150 that came from LA as part of the national stockpile, all of those have been completed and are done and are being sent back out into LA County. And I just want to encourage folks, if you have a line on ventilators, it doesn't matter if they're brand new. Maybe you have a few pieces lying around your basement or the house. I don't mean to be flippant. We'll take them. We've got the folks here in Silicon Valley that can do miracles with old equipment and refurbish that equipment. I just mentioned a few days ago that our community college system, they found 192 ventilators, not all of them in perfect shape, some of them used for training and the like, but we'll take whatever we can get. We currently have 4,252 ventilators that we've locked down. Our goal is to get to 10,000 ventilators. We're looking to procure new ones from around the globe, and we're hopeful that the federal government can assist us beyond the 170 that came into LA County. But if they don't, we'll be as resourceful as we possibly can. So on the physical asset side, that surge of 50,000 beds, we're making real progress. On PPE and lining up and identifying those needs, we're making progress, but still more needs to be done. But as it relates to personnel and people, nothing more valuable and nothing more potent to meet this moment. And so if you're a nursing school student or medical school student, we need you. If you've just retired in the last few years, we need you. If you are looking to expand your scope of practice and have particular expertise in any particular capacity, we need you, and we encourage you to take a look at that healthcorps.ca.gov website. 5 simple steps. We'll ask you basic questions, and we'll help you with your relicensing. We'll help you with the protocols and processes to get you up and running and get you out the door so that you can support the needs of people of the state of California all throughout our state. We've seen an increase, a modest 8.3% in terms of the total number of positives last night, 5,763 total COVID-19 positives in the state of California. But it's those hospitalization numbers, it's those ICU numbers that we are most focused on. And again, those numbers are starting to go back up again along the lines of our model. So the next few weeks are going to be critical in the state of California. In the next few weeks, we're going to do more to flex and to surge and do more together to meet this moment. And before I turn it over to the doctor, I want to just remind people of how they can meet this moment. All of you that have the capacity to contribute can contribute most significantly by practicing physical distancing, by continuing the good work that we've done in this state, including over this weekend. We had to shut down all 280 parking lots in our state parks system. We saw a reduction in the kind of surge of activity in our parks and on our beaches compared to the previous weekend, but we want you to continue to do that. There's nothing more potent and powerful in terms of meeting this moment than practicing that physical distancing. socially connected. Let's be resourceful in addressing the needs of others. And I couldn't be more proud of our partnership with Nextdoor and the volunteers, some 8 million people they were able to connect with, to check in on our seniors, to check in on people that are struggling with social isolation and may need not just food and medicine, but also may need a person to call, just check in and see how they're doing. So nothing more important for individuals, if they want to contribute in this moment, that continue to do the incredible work you have done in the nation's largest state to practice physical distancing. Number two, I just want to remind people that if you know anybody in the medical profession, if you know people that you think are willing to contribute their time and energy in a compensated way, to go to this new website so we can meet the healthcare surge as well. So partners, well, across the spectrum, private sector, Facebook, the public sector, with the incredible contributions of nonprofits and civic-minded individuals, will continue to row in the same direction, continue to meet this moment as we have in the state of California. In addition, and happy to answer questions, we are significantly increasing our efforts on homelessness. I'm happy to go into details around that, but I want to now turn it over to Dr. Constant, who has been part of our partnership with the California Medical Association, working across the spectrum of healthcare professionals that helped us with guidance and was willing to, again, work with us to create the flexibility, to create the kind of licensing reforms that temporarily are needed to meet this moment. And I just want to thank Dr. Constant for that effort and her energy, and ask her to come to the podium and talk a little bit more about what we're looking for on the medical side for this surge. Doctor.
Thank you. First, I wanted to take this moment to thank Governor Newsom and California's public health leaders for the swift action that they've had in terms of our physical distancing and our sheltering in place, because it is really helping the healthcare team. It's helping us. The time has really been crucial to help us learn about this new virus as healthcare providers, how best to treat it, and how to create the systems of care so that we're there and ready for the sickest when they need us. Today is National Doctors Day, and I want to first extend my heartfelt gratitude to all my physician colleagues, as well as everyone in the healthcare world taking care of our patients, for your vital service at this time for both our patients and our communities. This crisis is already impacting thousands of physicians across California, not just those who are directly taking care of COVID-19 patients, but also the thousands of others whose practices have been forced to close over the past several weeks. But even amidst this uncertainty and personal hardship, over 500 physicians have reached out to the California Medical Association to ask how can they help during this time, either directly treating the sickest patients or stepping in to help fill in the gaps for the people that are taking care of our sickest patients. In fact, all members of our healthcare team are showing tremendous courage and bravery, continuing to treat patients even though they worry about the personal protection equipment that they need to keep them safe. I am very grateful to Governor Newsom for his intense focus on delivering the personal protective equipment to our workers who are on the front lines of this pandemic, to ensure that California is doing everything that they can to protect our physicians, our nurses, and all members of the healthcare team. Many of us were drawn to careers in medicine because of the opportunity to truly help others. This is the work that we've been called to do. Now is our time. We're asking all medical professionals, physicians, nurses, physician assistants, and all members of the healthcare team to join us to take care of Californians through this surge. For many of us, that means stepping outside of our comfort zone and leaning into our inner strength. We're calling on the spirit of all healthcare workers across California to step up and help to serve the patients of our state. I've been humbled and deeply moved by the many stories of the physicians and others whose true selflessness has really led with compassion and heartwarming, caring solidarity through this. I know we're going to hear many, many, many more stories of this true humanity in the weeks to come. So thank you to all of you who've already worked long hours and who will continue to work tirelessly to help our patients. We truly appreciate you and thank you in advance for your continued courage and your service. And please reach out to the healthcore.ca.gov to sign up to be here for our patients and our communities. Thank you.
Thank you, Doctor. We're all struggling with the healthcore.ca.gov site, but we just got it up and operationalized. Look, I want to just make this point. I'm very proud. You know, California has some of the, well, in fact, the highest standards of personal protection, long championed by the Medical Association, long championed by the California Nurses Association in terms of ratios, in terms of protective gear. And those are things that we are very, very proud of. And I recognize at this moment of anxiety, in order to meet this moment, we've got to temporarily suspend some components of some of the licensing and scope of practice as it relates to meeting the care needs of those Californians. And so it took a lot for those organizations to participate and step up, and I want to just thank them personally on behalf of millions of Californians. We're very grateful for your willingness to do so at this moment. And again, I'll remind you, this is temporary. This is not permanent. No games are being played, and we have deep admiration and respect for all of you and deep gratitude that you're willing to work with us to meet this moment. So with that, broad strokes, that's the call to action today to all California healthcare professionals to help participate and go on this site. And we look forward to any questions that anyone may have as well.
Katie Orr, KQED.
Governor, we understand that the California Department of Health won't release the total number of hospitalizations county by county. Is that a number that you have? Do you have the statewide number of hospitalizations? And if so, will you make that more publicly available, given how useful it is to track the disease? Yeah, it's 1,432, as I said. That number substantially higher than the first number we gave you a couple days ago, which was 746. As a consequence, roughly doubled in 4 days. And we'll provide more information on that as needed. The number of ICU beds today is at 597. You may recall 4 days ago it was at 200. So can't be more precise than that. We have a 19.9% increase overnight in the ICU bed capacity and a 14.3% overnight increase in the hospitalization capacity. As it relates to your very specific component of question, as it relates to the county level, we will provide that information. I'll make sure you get it.
Carla Marinucci, Politico.
Hi, Governor. Thanks for doing this. I've got a two-part question. I hope that's okay. On the first one, we're 2 weeks into the Bay Area's shelter-in-place orders, and California as a whole is faring better than a couple of other states, New York, New Jersey, Louisiana. Just your thoughts. Do you think that those orders have flattened the curve in the Bay Area, as some UCSF doctors suggested over the weekend? And my second question is on school closures. We're 3 weeks into those, and some of the schools are providing instruction in different ways. Some are giving video classroom lessons. Others are pointing families to websites with worksheets. Does the state need to do more than just provide guidelines? And what do you think of the situations in which districts and teachers are engaged in disputes? So I hope that's okay, but two-part question.
Thanks. Let me talk about the schools. At 2 o'clock today, all 58 county superintendents are getting on the phone, and we'll have more detailed information to provide you after that conference call that goes deep into the issue, not only of distance learning, but special education and the issue related to food distribution. So that's the agenda today. And then a very sober conversation we're going to have about the expectations for the remainder of the school year. But the answer to your question is yes. We need to do more, and let me fill in the blanks based on the details that come out of that call this afternoon. And by the way, on Thursday, we have another webinar specifically related to distance learning for special needs kids as well, which only reinforces my affirmation that, yes, we need to do more, and we are trying to do that in real time. As it relates to the bending of the curve, I'm not going to we're in the middle of this, and I think it would be too easy for us to assert a belief at this moment about what has or has not worked, except to say this: we know what does work, and that's physical distancing. And we believe very strongly the stay-at-home order has helped advance our efforts in reducing the stress on the system that we believe would have already materialized in more acute ways had we not advanced those protocols when we did. We have not been sitting around over the last week or two. We have been preparing over the last week or two, and that stay-at-home order has advanced that effort. It's bought us time to prepare. But I want to make this point. I made it from the outset. When you see a tripling of the ICU beds, when you see a doubling of hospitalizations just over a 4-day period, that's a point of not just consideration, it's a point of obvious concern as it relates to our ability to meet not only the physical needs of that surge, but the personal protective equipment that is required of it, and obviously the human capital that we're speaking of today. And so I don't want to say that it's worked, but I will say I think we have benefited in terms of our capacity to prepare, but we're very sober about what these trend lines are looking, or at least instructing, over the next couple of weeks.
Adam Beam, Associated Press.
Governor, you mentioned you wanted to increase the number of medical workers by about 37,000. That just seems like a really large logistical challenge. I'm wondering how the state can go about doing that in a short amount of time. And do you know where they would go? Would they go to field hospitals or existing hospitals or both?
No, and thank you for the opportunity to clarify. That's just the universe of individuals that are retired or inactive licenses that we project are out there. So that's not the number that we're trying to bring in. That's the universe that we're trying to cull from. So we're looking for thousands and thousands of individuals. And again, it depends on the expertise. It depends on the specific skill set. And we're parsing those out throughout the system, working very collaboratively with our entire hospital system, as well as our skilled nursing facilities, our assisted living, congregate facilities, and the like. It's all part of this larger system. And so we're scoping a universe of 37,000, and those will break down in real time, and it's geographic, it's system by system, it's capacity that we're looking for. Let me be specific. When we open up the sleep train center, it's a capacity we're looking for when we open up these field medical stations. That capacity differentiates itself on needs. In Riverside, they may have certain needs. Santa Clara County has different needs. Counties can absorb more in these more resourced parts of the state. They can absorb less, so we have to supplement that in other parts of the state. So it's an iterative process, but the universe is 37,000, and thousands is the number that we hope in very real terms, in short order, will present themselves, and we can start making those matches.
Rachel Swan, SF Chronicle.
Hi, Governor. I just wanted to clarify again about this 37,000. Would the nursing students you mentioned, would they be granted provisional licenses to practice? And then what would happen after the pandemic is over? Would they go back to school, or what would happen?
Yeah, let me ask Dr. Galley to come up and can talk specifically about that.
Sure. So our goal is to recruit both retired and active folks, people who have part-time roles now who can increase their hours. And to your specific question about students, depending on where they are in their training, we're obviously looking to people who were near graduation and fulfilling their degrees. So many are not able to finish those last few months because schools are out because of the COVID-19 response. So who better than those folks who are really close to being done to bring into the workforce now, essentially continue their clinical training with the support of experienced nurses or other health professionals that are in the same line of work that they will be, and invite them into the work. And depending on where they were and how many months they are surging, we will have to work with our licensing boards to determine whether they've completed enough of their training to get fully licensed on an ongoing basis, or whether they need to return back to the classroom and their clinical rotations to finish up and get their license down the road.
Next question.
Angela Hart, Kaiser Health News.
Hey, Governor, thank you for taking our questions. We wanted to ask, so looking at your projections and the modeling that you all have done, when do they indicate that the state could be reaching the capacity in terms of the hospital beds needed? When could they be overwhelmed? Roughly, if you can't provide a specific date, when roughly would that happen? And then just one more thing to tail on the end of that is we're wondering if the state's plans to expand capacity are being done in addition to what individual hospitals and hospital systems might be doing, or is it spearheading the across-the-board response?
Just on that, we are working hand in glove within the system. I'll remind you, roughly 75,000 licensed beds in the state of California. We requested a surge of the system, 50,000 beds, 30,000 of those requirement within the hospital system themselves, which represents roughly a 40% surge. And so that's actively being advanced within the hospital system itself. We are required for the additional 20,000 to go out and access and resource additional capacity. As I said, USNS Mercy is part of that. All of these field medical stations are part of that, and all of these other hospitals that we're bringing online, Fairview, Porterville, and these other assets that I referred to that the Army Corps of Engineers and others are looking towards are part of those 20,000. So that's an integrated strategy within and externally outside of that system, but all being coordinated through the folks here at the State Operations Center. As it relates to your other part of the question of when we're seeing peak, that's determined on the basis of our personal behavior. That's determined on the basis of abiding by the stay-at-home order, making sure essential versus non-essential business is being conducted, and on the basis of our modeling and projections over the last weeks, not just those 4-day period that I gave you as a snapshot. I can just say this without getting into the specifics and showing you a chart of a worst-case scenario or a best-case scenario and having people run with those things, that over the course of the next few weeks, we are very confident that in the aggregate, and that's a distinction, in the aggregate, that we will be able to resource the needs both physically and, if we're successful with the healthcorps.ca.gov efforts, with the human resources. In addition, though, I continue to make the case that PPE and the supply side of this continues to be a challenge. Despite the 32.6 million N95 masks we put out, tens of millions have already been requested of the state throughout our system and beyond the system. As you know, this is a huge issue for our grocers, a big issue for those that deliver the groceries, and many others that are also looking for personal protective gear as well. So we need more work there, resource on the health and human service side. But over the course of the next few weeks, I have some confidence in our capacity to meet the moment. Dr. Galley can help fill in and amplify or redirect consideration to what I may have just said.
Governor, you hit it right on the nose. I think at the moment, the modeling that we show and where we are with our projections and actuals is that our current efforts around surge meet the moment, and that we're able to take care of anybody who needs a hospital bed today, anyone who needs an ICU bed or needs a ventilator, and our efforts to increase staff, increase beds, increase supplies are on track to continue to meet that for weeks to come. And just to reiterate what the governor said, that as we continue our physical distancing efforts, that those are going to help us change what those curves and lines look like. So to continue supporting our neighbors and our communities to do that well is of utmost importance.
And I know it's an old mantra, decisions, not conditions, determine our fate and future. Decisions, not conditions. So I don't live on the basis of economic forecasts any more than healthcare forecasts. I live on the basis of our capacity to bend curves, to change expectations by changing behavior. And that's why what Dr. Galley said is so foundational, so incredibly important. The power and potency we have as individuals to radically change these projections. It resides in each and every one of us, in each and every decision we make each and every day. And that social pressure we're seeing out there for people to do the right thing is the most powerful enforcement tool we have. And we'll continue to use that as our moral authority is advanced all throughout the state of California. And to the extent we have to exercise our formal authority as it relates to licensing and business revocation because people abuse it, and law enforcement, we will. But again, I'm just incredibly blessed and pleased to live in a state where so many people get it and increasingly are getting it done. Next question, please.
Taryn Luna, Los Angeles Times.
Hi, Governor. I have a two-part question. So one is, based on your community surveillance testing and your modeling that you've done today, how many people do you think are infected with the virus in California? And then the second part kind of adds on to what Angela asked, but I'm curious why you're reluctant to give a peak date and why Californians shouldn't know kind of the date that the administration is working off of right now.
Well, because first of all, just on that, it's a dynamic model, and it radically is different, I can assure you, than it was just 4 or 5 days ago. And if we had a model that I can more confidently say, based on all of these conditions and everything being static, then we would provide it to you. But I can assure you we are running those models in real time. And remember, these models aren't just on the basis of current infection rates or the community surveillance and the testing. It's also on the basis of movement. It's a basis of all these inputs. We mentioned this a few weeks ago, working with Esri, working with Blue Dot, working with Facebook, Apple, and others. We have our modeling that is done on a daily basis based upon these patterns, as well as patterns across the rest of the country and around the rest of the world. More specifically, though, Dr. Galley can fill in a little bit more in terms of making sure that you're satisfied that we are providing that information in real time and give you a sense of preview of our thinking as it relates to making more public those best and worst case scenarios.
Sure. I'll come back to a number that the governor uses frequently, which is our 50,000 additional beds. That number is based on the model. So we are preparing it. We call it our phase 1 number because we know that depending on how we perform with our physical distancing efforts across the state, that number is tracked towards an expectation that we meet this moment with physical distancing, and that's what we're going to need based on our models. We project that we will need that towards the second half of the month of May, so we are very busy trying to build towards that. That includes at least an additional 10,000 beds in an ICU setting with ventilators to be able to support that number of patients. So those are the numbers we are certainly working towards. It does not mention the total number of people who are infected or who test positive, because that is highly dependent on our increasing work to bring on testing. But the lives and people in emergency rooms and hospital beds and in ICUs requiring ventilation support do not lie. We have good intel into those numbers on a daily basis with all of our healthcare partners, and we believe that will continue to guide us on this road that we've been on towards that middle of May target, and we are constantly reassessing, as the governor has said. These numbers are very dynamic. We know that every single day we get additional information about what the actuals are that help us adjust that model. And we hope, because of our great performance here in California with physical distancing, that we will continue to tell positive stories of where that's going. That said, we continue to prepare for a situation where we'll need at least 50,000 beds. And if we need to adjust that and say we need more down the road, I'm confident, and the governor will be communicating that to all of you in real time.
I should just note on the modeling, one of the areas that is also dynamic is not just on the surge modeling, but the slack of the system within the system, meaning the hospitals have done a magnificent job as it relates to reducing the number of elective surgeries and reducing the total census within the hospital system to a degree that, candidly, in our original models, we did not anticipate. It just goes to the incredible capacity within the system to prepare for this moment. And so, as a consequence, on the surge, that slack, that number, phase one, still remains around 50,000, despite all the other changing conditions in and around our modeling.
Hannah Wiley, SACB.
Hi, Governor. Thanks for taking questions. Can you more explicitly explain how far the executive order goes in terms of suspending the rules? What exactly are you waiving with respect to staffing ratios and scope of practice?
Good. I'll let Dr. Galley, who helped prepare it, answer that in more detail.
So essentially, we, on two fronts, I'll mention it does mention the ratios and allows us to work with our facilities and our labor partners to move beyond our current ratios, whether that's for nurses or other staff positions, so that we can meet the demand in our surge facilities and existing hospitals. So it is not specifically outlined to the number, but it does give us the flexibility and room to work within reasonable measures with the current or the conditions we expect. In regards to who we are inviting back into the workforce or accelerating them into the workforce, there are a number of things that have to do with who can get licensed, how they can reinstate their license, and being flexible and waiving some of those tried and true conditions that allow us to, for example, somebody who's been out of the workforce for just under 5 years or 5 years and less, to allow them to come in immediately to meet the surge demand on health workforce. So it's both in the areas of staffing ratios as well as allowing individuals to come into the workforce that are currently not there but do have the capability of being licensed very quickly.
Next question.
Jonathan Ayestas, KCRA.
Hi, Governor. Thanks for taking questions. Wanted to see if there were any updates on numbers for testing kits, as far as how many are available to the state for those testing for COVID-19, how many are needed, and what the backlog is for pending tests right now.
Well, the biggest backlog is swabs. It's now the principal limiting factor of our ability to increase tests throughout the state of California. Swabs, as well as the media to transport the swabs. We continue to need, though this becomes less of a restrictive reality, the reagents, the RNA extraction kits, but for some of the other older protocols, old by standards of days, not just weeks, we obviously see the need for more of those reagents and RNA extraction. That said, the new throughput technology that's coming on, all of the announcements you've heard in the last 24, 48 hours, including this morning, there is not a company that has been referenced either by your own reporting or someone else's that hasn't been in contact with us, that we're not in contact with. But I want to caution folks on this. The scale ability of some of these promoted testing protocols, 10-minute home test, 45 minutes, whatever it is, the scalability is not there as advertised. And I say this because we're practitioners of this. We have the resources, and we're deeply engaged with these companies. They have many parts, but they are missing some others in order to adopt and strategize the kind of scale that is being promoted and people are demanding and deserving of. The answer to your question is we need exponentially more testing throughout the state of California, and we've been looking at advanced conversations on looking at blood-based tests, looking at the antibody frame, which is all part of our strategy to get people back and move from dealing with this crisis head on to coming coming back into some semblance of normalcy, and those protocols and those processes, those negotiations are happening in real time. I mentioned just yesterday we were down, or day before, at Bloom Energy. Right next door to us was one of the, a well-known, at least well-discussed company in that space. They're a California-based company. We're engaging them along with many, many others. I don't know if, Doctor, you want to amplify this a little bit more, but this is in real time 90% of what I think Dr. Galley is doing.
That is the case. We are working with just about every testing entity that we can reach out to figure out what they can provide California. We know that it's not going to be a single solution, as the governor said. There's not one company or one strategy that's going to make a difference. We continue to work on the PCR tests, which are the ones that I think many people are familiar with, and now moving into the serologic testing zone to allow us to bring on another modality to meet our testing needs across the state. We continue to work very hard to make sure that people on the front lines, our healthcare workforce, our first responders, get the testing they need to feel safe and confident that they can be with their families and continue to work. And additionally, that we get patients in the hospital who we aren't sure if they are COVID-19 positive, but we suspect they are based on their symptoms, the test so that we can take care of them in the safest, most efficient way. So all of those priorities notwithstanding, we continue to grow our testing capacity, both that's sponsored and supported by the state, but those efforts that are happening locally, county by county, system by system. And we're here to fill in those gaps, supporting those systems to be able to scale on their own, so that together the local story with the state story lifts up an enormous amount of testing available to all Californians, so that our projections can be validated and we can look into the future with a little bit more information.
And just to provide a little bit more information, it's not just the specimen samples, it's not just the diagnostics, it's how long the diagnostic process is taking. The number of pending tests out there is extraordinarily frustrating because of the delay in getting that information back into the system, into the patient's inbox. And so tens of thousands of tests have been conducted, but we do not have the results yet. And that's the number of PUIs that we reference, people under investigation within the hospital system, in our ICUs, that we have made public over the course of the last few days and will continue to make public, but also more broadly, men and women that are watching first responders and frontline employees that deserve to know those test results. You're hearing 6, 7, 8. I heard example of 12 days, one case, to get those test results. We need to see that improved as well.
Final question, Elizabeth Aguilera, Cal Matters.
Thank you. I wanted to ask just if I could do a two-part question. The first question is, their health course site that you're talking about says that this is going to be paid for, and that physicians or other healthcare professionals who sign up will be paid, malpractice insurance will be covered. Can you discuss if the state's going to be covering that, if the entity that you send folks to is covering that, and what is the estimated cost or the budget line for that, at least now, not knowing who or how many people might sign up? And then on the second question, maybe for Dr. Galley, is can you be more specific regarding changes to scope of practice, especially regarding nurse practitioners and physician's assistants, because other states have been giving independence to those professionals, and there's also been discussion, in the legislature for several years regarding that as well.
Well, we're providing the temporary flex in that space through June 30th, and those conversations we're all intimately familiar with in the state of California, particularly with our nurse practitioners, but this order does provide that flex through June 30th. Let me speak about the costs. The costs are being borne in a myriad of ways within the system, by the state, as well as the federal government. FEMA and their reimbursement processes, obviously the federal support that we're receiving will help us with those efforts. The cost, though, we will address and is being processed in real time. And I can assure you cost is not the issue from my humble perspective. We are always mindful of costs, and we do not believe in waste or abuse. And by the way, let me talk about abuse when it comes to procuring PPE. The scams out there are real. People are being investigated, not just for price gouging, but investigated by FBI and others. And I just caution individuals, again, this is a time individually, not just for large institutions like states and hospital systems, to be very, very wary of people that overpromise and don't deliver at all, let alone under-deliver, and people that are scamming individuals at the moment. But we are not in that business, and we will provide appropriate compensation for individuals, and that comes through the traditional system that provides those support, be it the Medicaid system, Medi-Cal in California, Medicare, myriad of other supports that come through the federal government as well as the state government. And Dr. Galley, perhaps you want to amplify on the nurse practitioners, but I think that question was answered. June 30th, temporary, and ratios along the same lines as well.
Yeah, the only thing I would amplify is that we set dates around this, and we are always looking at whether those are the right dates based on the conditions on the ground. And as the governor said, this is not, there is no effort here to extend beyond our surge need any of these flexes or rule changes, because we are sensitive to the ongoing conversations with a number of people who are here with us now and haven't been as much in recent days, that these are decisions that Californians take very seriously, that we work hand in glove with our legislators and our trade organizations to make in this unique situation where we are prepared to meet the needs of thousands of Californians. Tens of thousands of Californians needs this now, and we will be looking at it over the weeks and months to come.
Thank you. So that concludes this conversation. We look forward to many more in the next couple of days. Let me just make one closing statement. I just want to thank our partners at the county level and the city level, Darrell Steinberg, among many others, Mayor Liccardo and Mayor Garcetti, Mayor Libby Schaaf. I can continue, Mayor London Breed, others that have been active in trying to get resourced through the state's procurement of hotel rooms for homeless individuals. We're up to over 5,000 hotel rooms now that are available at the county level, at the city level. We recognize we need to do a lot more, some 5,491 rooms to be precise. We're getting those trailers out, but we don't want to get them out until we have the support services overlaid. We'll be meeting with CSAC on the phone teleconference today to talk more, our counties, about how they can continue to support the most vulnerable Californians out on the streets and sidewalks. Again, top priority for us, and we recognize we have a lot more work to do in that space as well. I'll just close by reminding everybody at home, we also have a lot more work to do to continue as patiently as we can to extend the stay-at-home order, and recognize that, if you've ever, gone skydiving, the worst thing a human being can do is cut the parachute when you're not even close to the ground. We're not yet close to the ground. So let us not run that 90-yard dash. Let's continue to follow through on the incredible work that's been done and the commitment that we all have to meet this moment head on. Take care, everybody.
And there you have it, Governor Gavin Newsom there updating on the state of the state dealing with coronavirus. He was talking about the need for more healthcare workers throughout the state, the licensed healthcare workers, as well as just pretty much more of everything, but also reminding people to shelter in place as that still is in effect. Now, we were monitoring two press conferences. Also, Mayor London Breed announcing that the shelter at home has been extended in San Francisco to May 1st. Previously, it was set to April 7th, but that is now extended to May 1st. Now, we're going to have an update on all of what happened in both of those press conferences coming up for you later at 5 o'clock as well as 6, and our special coverage of the coronavirus at 7 o'clock tonight. Of course, you can always go to our website, NBCBayArea.com, to get the updated information. There is a section for coronavirus. For now, we're going to send you back to our scheduled programming, Access Daily.